Now, I want to spend a little bit of time talking about this because I know practitioners are a little confused about it, because it is possible to get some unwanted effects when you first start prescribing Vitex. And this is my observation over many years. So Vitex response is typically fairly rapid, but it can vary depending on the age of a woman. So younger women tend, particularly if they've got primary dysmenorrhea, in the first cycle to aggravate. So they can get worse period pain. And with all of these things that I'm going through, it's essential that you talk to your patients about these possibilities, because there's no point saying to them after the fact that they might get bad period pain, because you know it's much better if it's talked about and discussed properly before these kind of things happen. Some women have an aggravation of acne as well, but these things usually settle down. So if you see them, I know a lot of practitioners stopping using Vitex when these symptoms happen, but don't, just keep going. In older women, you tend to see more likely, but this is not everyone, an aggravation of PMS and particularly breast pain. So if you're treating older women, that's more likely to be the case. It's less likely to be dysmenorrhea that will aggravate. And Vitex can also increase fertility. Now, I know as a profession we're a little bit obsessed with infertility, but it is necessary to say to women in their 40s who've perhaps finished having their family that if you use Vitex, it does increase their fertility. And we've had a number of unwanted pregnancies in the clinic where we've been treating women for other conditions, and their fertility's increased, and they have been had a relaxed attitude to their contraception. Okay, so dysmenorrhea tends to aggravate in the first cycle. PCOS, if Vitex is incorrectly prescribed, it can tend to lengthen the cycle. Curiously, with endometriosis, I don't know if anyone else has noticed this, but we notice it in our clinic. If you use Vitex, a lot of women think you're absolutely fantastic because for the first cycle they have no period pain. And what you need to tell these women is if you get dramatically better, you'll probably get worse in the next cycle, because that's usually what happens. And then progressively over time things settle down. Breast pain can aggravate, and less commonly PMS can as well, but these are all generally in the first cycle. So what I've been seeing is an exacerbation first cycle and then steadily improve, or a dramatic improvement, and that tends to be endometriosis. Or women will just steadily improve, and that's the most usual response to Vitex treatment. If there's no change, absolutely no change in 3 cycles, I think of another herb. I would tend to stop Vitex. And if there's headaches or lengthening of the cycle, I also consider those to be indications to stop Vitex.